critiques is just train normally.
Yeah.
We train muscle and fascia.
Right.
Why do we have to train fascia independent of
Yeah.
muscle?
So the same reason that we have to train aerobic and anaerobic independently,
Yeah.
right? Because everything is aerobic training right now,
Right.
right? So yeah, I fully understand the premise of that counterpoint, but the reality of it is that there is a completely different application from a conventional bilateral back squat and having a barbell one side load rotational lunge. Those are two different applications that are going to, command different things from the body. The other aspect of it is like we look at it from a training parameters perspective. If I do the same, the same exercise for 5x5 at 85%, and then I follow it by doing 5x3 at 60%, different structures are contributing to those movements. So in this regard, it's the same concept where we can utilize training parameters, position, structure, surface that we're working off of to implement and get some different result or some different stress application that can bias more connective tissue versus more conventional contractile loading.
So what then, that's the question, what is the adaptation that we're trying to elicit through this type of training specifically? That we don't get if we're just doing traditional exercise.
For sure. So I think, without saying, we need to have context to that, I think in general, the first thing for me is the coordination of movement. And I think that just includes a lot of the proprioceptive aspect, some of the neurology to it, some of the different sensory patterns. But I think the other aspect of it is, when we have an appreciation for position, and to use your word, shapes, those positions, and those differences in how we're structuring the athlete or how we're applying the load are going to change what that emphasis is on, whether it's contractile or connective tissue. The other aspect of it is being able to move in multiple planes of motion with proficiency. Track and field is kind of the one anomaly to this where there isn't a lot of variability, so we can kind of make the argument that, okay, the majority of what we're doing should be in pretty linear patterns and pretty conventional patterns of motion. I think anything outside of that, well, I guess
I would argue against that.
Well, Olympic too, I would love to hear. But the football, basketball, soccer, all these, and then general population, there's nothing linear about it. We have to be proficient in all these different aspects. But I'm absolutely all ears here.
Yeah. No, we can talk about it for days, and we have been for days already. The way in which, for me, the way in which you are communicating what this is, and I look at everything this way now, so it could just be my bias, but I look at it through a systems perspective. And a system has a hierarchy. Between its three things, right? Every system has component parts. All those component parts are interrelated and connected, and they serve a common function and purpose. And the hierarchy is top-down. It's a function purpose first. It's the interconnection interrelated in second. It's component parts third and last.
Yeah.
Now, that doesn't mean that you can just have crappy parts and be able to connect them and interrelate them really well, and they'll lead to a great function or purpose and great performance. You still have to have good parts. You still have to have pretty good muscles, pretty good tissue. But it's the connections between those tissues, between those muscles, how they coordinate in space and time to serve the common purpose of whatever task that you're doing. That's more important, far more important. I feel like that's what we're really talking about. Right?
For sure.
That's fascia's role.
Yeah.
As you said a few times now, coordination or interconnection or connection, connective tissue. And I think sometimes we just hear these words and say, connective tissue, muscle, fascia. We don't really think about what it actually means, what it actually truly means to movement, and what this connection means. A connection is really, really important. How do you connect your limbs in space and time? Is everything about sport. I think sometimes we just get lost in just words and terminology and some of these other things where I think if we really break it down into what this really is, it's just that. It's just a system. And it's just adhering to all of the other rules of every other system. Because it's a system, as you said before, it's a system that nests within a system, that nests within another system, and is nesting within a system. And at all sort of different layers.
Yeah. So two things on that. That was abundantly clear to me when I did the fascial dissection course up in Colorado a couple of years ago. And they actually introduced it this way. And the way that it was Ty Garcia, the way that he instructed it was, you can create as many separations and as many layers as you're skilled with the scalpel.
Sure.
And that punched me in the face. I'm like, oh wow, okay. So and when you start to see, and that was, you know, that's why I do get bent out of shape when I get, you know, people having comments just to be that person with this, you know, because there's this, you know, mystique to the fashion stuff. But after that course, after day one, I walked out of the building. I was like, okay, it's real.
Yeah.
It's a real thing. This is really what we're doing, what we're seeing. You know, because the body's more embalmed.
I mean, just look at Headley's YouTube video, and you know the fashion.
100%.
Right?
Yeah.
It takes 5 minutes. Just look at the video.
It's a very real thing. It's a palpable tissue, and it was that. That's why I think I use perspective probably almost in the same capacity as you use systems. Because for me, it was like I didn't learn anything new. It wasn't a different species. It's the same body, but the way in which I was seeing it became distinctly different, and then that carried over directly into practice and directly with movement and exercise, like all the things, right? It was like, okay, so we need to think about the way in which the hamstring roots are oriented and how the adductor magnus is kind of situated in between. And then, okay, well, what if I have somebody who can't access internal rotation? How does that affect the magnus when they're in extension? And I can go through the constituent, again, isolated anatomy pieces. But when I just think about that deep spiral line or that deep longitudinal line, I'm like, okay, there's a direct correlation between what's going on at that hip in extension and where that foot is positioned and where the pressure is. So now I need to think differently about how I'm going to approach that, how I'm going to try to intervene on that, and then how I'm going to organize it and planning thereafter. It's two different things. Because if you just have that musculoskeletal anatomy, there's not that same, it's not to say you can't solve it, but it's not the same intuition. It's a much longer route to get to that endpoint in my mind. Maybe that's just because I sucked in college anatomy, but in my mind, it made everything very quick and impressionable.
Yeah, I was going to ask that. Like, does this make your understanding of this now? Does that make the job harder or easier for you when you're prescribing programs for
Much more fun.
Much more fun.
Much more fun.
Yeah.
I would say much more saturating. You know, I think.
Are you still choosing from a list of sort of foundational movements, or are you now being creative?
Yeah, for sure.
No, I'm seeing this, so I have to be creative with this and X.
No, I don't. Creative never crosses my mind
No.
ever. I don't ever think about it as like, you know, my artistic style. I just think about it's simple. What do I see? What do they feel? Here's what I think they need, and it's best guesswork, right? It always is. So, you know, I think to kind of answer that though, what I have, you know, felt like over the last several years, however many years, is that I do have the same or similar like little series or protocols where, like, to stick with the same theme, somebody who doesn't have good hip internal rotation and seems to be limited in extension, then I probably have a similar series for that person, barring anything else.
Sure.
So I do think it's made it more efficient for me, for sure. I think that the way that I'm able to kind of see movement has changed pretty dramatically. And I think that the fun aspect is I don't have to just I don't have to try to solve all these problems or issues or address these things, because we don't solve problems, right? It's a continued thing from this small toolbox, this small window of things that we can pick from. I think the other thing that comes with that is the perfection of movement. And we have to, if you're doing a deadlift, you must have this and you must have this and all of these like robotic, you know, if you deviate from this or if you breach this, it's wrong. Or disagree. I disagree on that. I think that there is a reasonable agreement point on what we should see from these big compound lifts or whatever. But I think that, again, movement is just much more versatile. I think it's much more unique. It's stylistic depending on who the person is, what their limb distributions are, and what they do. And so I think that from a strength and conditioning standpoint, we have been poorly conditioned to try to pursue perfectionism.
Sure.
And it doesn't exist.
Foundational lifts to continue with in traditional strength conditioning training. Squat, hinge, pull, carry, twist, whatever, right? You choose your lifts. Is there similar foundational lifts in fascial training? you're saying it kind of is. You know, if you see this and this sort of dysfunction, this aberrant movement, you've got a list of 2 or 3 or 4 things that you may apply to.
For sure. Yeah, and that's probably one of the biggest misconceptions with all of this is that if I were to, you know, suggest that I prescribe or perform fascial-based training, aside from BS, the second thing that most people will think is, oh, okay, well then he never loads any of his actions. Absolutely untrue. The slight difference is how we're loading them, what the position body is, and then how much or how frequently we're doing that. So I would say if we just have, you know, an apples to apples comparison here, I'm going to have 1 to 2 structural lifts per session.
What's the structure of it?
A squat, a pull,
Okay.
yeah. But I'm not going to do it bilaterally. We're going to work out of a split or a staggered stance or a single-legged back pull, and we're probably going to do 1 or 2.
Yeah.
Where I think if most, again, contemporary general strength and conditioning coaches could make the biggest change with the least amount of effort in their programming, it's stop doing redundant accessories.
Yeah.
You know, that's really where I think that it's becoming time wasting for a lot of people. So,
Give me some examples.
if you have a squat day and your accessory bank includes a goblet squat, a rear foot squat, a dumbbell RDL, and a reverse hyper, you could have filled that time a little better.
Sure.
So for me, we're going to do our warm up and movement prep. We'll get to our primary block. Our primary block will include one of those primary structural lifts, and then basically we're just going to start to kind of tear away from that. So for anybody who's followed me on social media over the years knows I love the landmine. I get a ton of application out of the landmine. I just think it's a really good tool. We do a lot of different things. It's accommodating for different people. A lot of kettlebell work, a lot of med balls, a lot of dumbbells, and really just taking the same base constructs of movement, tweaking them slightly. So instead of just doing a dumbbell bilateral RDL with my heels down and, doing a perfect hinge pattern, I'm just going to stagger the feet, go into a kickstand, and add a slight rotation at the end of the motion. Because I don't need any athlete ever to be the best in the world at doing a dumbbell RDL. I need them to be able to extend their hip rapidly and access internal rotation and length. So from that perspective, the staggered stance for the kickstand spiral RDL gives me a little bit of a better aptitude for that as opposed to doing it conventional.
A little velocity. Is fascial stuff generally a little executed at a higher velocity than traditional and more muscular work?
I think speed or velocity is essentially the programming, centerpiece, so to speak, for fascial-based loading as excess load is for conventional. So I see the amount of weight that's on the bar as the byproduct, and then the speed, the coordination, and the quality of the movement is the focal point. If we do it well and we can do it with reasonable velocity and you can put more weight on, but it's not vice versa. It's not we have to be at 425 today, so we're just going to forget everything else and focus on that. The load is a byproduct, right? And I also think, again, that with all things being equal, if we become too obsessive about just purely what produces the most force, then we are training athletes to be better at lifting weights as opposed to being better at what they do.
But on no velocity, with isometrics. What is fascial training have to say about that type of thing? We know there's obviously a lot of research around isometrics and connective tissue, tendon health, and so on and so forth.
So can we kind of isolate that to the foot and the ankle?
As well?
Yeah,
Absolutely.
Broadly, yeah. I think that, again, no differently than it applies to all of those tissues, there's application here as well. Eccentric, isometric, reactive. But for isometric specifically, I think that there's a tremendous amount of value in foot intrinsics and foot isometrics. I still absolutely have a small sample size with pro athletes and even with the high school and college athletes. So still a small sample size, but I would argue that 80% of the athletes that I've worked with have zero intrinsic foot strength. Very, very weak below the knees. or ankle motion in whichever direction you want to pick. No ability to supinate. So what I've started to do is really just take the spring ankle series, essentially from Cal Dietz, and just utilize that in a number of different ways. So I'll use that as an evaluator, a daily evaluator. I'll use that as a movement prep or a warm-up. I'll use that as an intraset, and then I'll start to kind of see where those leaks or those gaps are for a certain athlete, and then bias towards their deficits. So for that, if we have someone who's coming up with their heel off the ground and they just can't get into any sort of pronation, then we bias towards that. Adding to that, the fascial consideration for the foot and the ankle predominantly is going to, of course, be the plantar arches. Mm-hmm. And with athletes, we tend to see the falling of the feet. We tend to see zero ability to extend the toe. We see bunion formation, and we see a loss of supination. So all of those things are suggestive of a chronic shortening of that plantar arch or of those plantar arches. So what I think about is not only just trying to create the length, but then for the isometric piece, once we are able to access that length again, that's how we're going to strengthen it, because that's the foundation for the windlass and toe off and ground contact and everything. And if we can't produce that, then it has to come from somewhere else. When it comes from somewhere else, then we get repetitive overload. And then we start getting into the stress shielding concepts and all those different things. But that, to me, is one of the lowest hanging fruits for anybody, and it's very rarely done well.
Going back to sort of comparing the fascia training, and maybe specifically zooming out a little bit, the training principles that apply to the traditional strength and conditioning, overload, specificity, so on and so forth, apply also to fascia? Or do you see it as being a little bit more general?
No, I think it applies the same way. And if we kind of recall back to the 3 C's of connect, coordinate, communicate. Right, those are kind of the big overarching principles.
So hold on. So connect, coordinate, communicate. Mm-hmm. So what do you mean by that? Let's just divide it down.
Descriptors of the fascial tissue, the fascial system. Okay. So those are the 3 overarching points that I'm always going to relate back to for justification of programming, so to speak. So with that being said, connective tissue, no differently than tendons and muscles, needs to be overloaded. There needs to be mechanical breakdown, right? Mm-hmm. So what I've always thought about is, in the same way that we get mechanical breakdown in a quadricep from the back squat, why can't we have the same thing with a cross-body kettlebell swing holding 80 pounds or 60 pounds or whatever it may be? Because that's what people always try to point out, is that's not enough load to create an adaptation. Well, it may not be enough load to create an adaptation if we're talking about a big muscle or a big muscle group. But if we're talking about the connective tissue that runs non-linearly throughout the torso and some of those deeper, stabilizers or supporting structures that surround the spine, I think it is enough load, because it's all coming back to locomotion. And the way that the fascia is arranged and situated throughout the body is strikingly reflective of what our gait cycles are. So if we think about the myofascial lines as being where we're getting more collagen deposition and then getting more breakdown and then getting more buildup, so we have this denser tissue, or we have more fibrous tissue that create these lines or chains or trains, then that's the same concept or application for the training piece. We need to be able to load through these lines and through these segments, and overload for structures like that is different than overload for a push press or an RDL. So that's really the big difference for me, is that the relativity of load may just be off-putting or unfamiliar to people, but we do still need to overload in all these different directions, patterns, planes, and paths. Yeah.
Makes sense. One of the ways I look at that is like the lower the magnitude of the load, the more the frequency of that load that's going to be to listen meditation. So if you've got a lower relative magnitude of load, is it that simple? You just need to be more frequent with how you do it. And then
for sure. Yeah.
The way I sort of do it in my own fascial work is like we do it every single day.
Yeah.
It's the same patterns every single day. And you're only doing, it's like, that's a stretching, one example that I generally do some of the athletes I do. If you stretched really, really hard for 10 seconds once a week, are you going to get more flexible? Probably not. It's the same with this stuff. Right? You can't just do this once a week or even twice a week or 3 times a week. To get to listen adaptation from this type of work, the frequency of the load has to be there all the time. Every session that we do, you have to address this. That's
Yes.
simple for you?
Yeah, I agree with that wholeheartedly. Yeah. You know, and I think that the other thing that kind of comes to mind with that is where the distribution is kind of like where the load is placed, where the body is positioned, and then what the vector of movement is. And because again, like this is something that I think I've seen most with like some of the college athletes who are just in the thick of pure force, pure overload, volume. The fatigability of anything outside of those cardinal planes is insane to
To
me.
go back to something we talked about a little bit earlier, what does this look like in practice? Let's say coach just wants to now start applying more of a fascial-based systems approach to their training in the weight room with a youth athlete. Is it, as you said before, you're identifying 1 or 2 foundational movements, whether it be a squat or a hinge or pull or a lunge or whatever that is. And then rather than continuing down that vein with all their assistants and then tertiary, secondary movements, whatever, we can apply a more of a multiplanar, multi-velocity, sort of fascially based secondary, tertiary exercise after the primary. Is it that simple for many? Is that kind of the door into this?
No, I mean I think it could be for sure. One of my taglines for this is that it's more so a change in perspective than a practice.
Okay.
So it's more so about why or how we are doing something as opposed to just the X's and O's of what we're doing. But to give you a less esoteric answer there, I think that the first thing that the general high school athlete or strength coach could do or use to improve the fascia qualities is doing portions of their training out of their shoes. Number one, for sure. Number two would be to do less bilateral movement. I don't think that bilateral movement is great for fascia, and frankly, I don't think it's particularly great in general for anybody outside of powerlifting and Olympic weightlifting. And then I would say number three is to have some level of variability to your accessory plan. So you mentioned it a little bit, but if we put the words to it, I would say, I'm more compound, biomechanically driven in that early portion of training, and then I kind of peel back a layer. I'm probably a little bit in the middle in that second block, and then in the third block, it's all biotensegrity, it's all movement, it's all fascia. So I do have some balance within every session. But for again just the general how do I do more fascial based stuff, start with those, and then from that point look at your job as being able to improve the athlete's ability to tolerate variability, as opposed to getting them as strong as I can possibly get them, or getting them as fast as I can possibly get them. Once again, track being somewhat of an outlier, but for the team sports for sure, how can I improve this athlete's ability to tolerate variability? Because sport is a microcosm of chaos. And it's not about proficiency in one or a few things. It's about resiliency and durability throughout potentially anything. And I think that correlates very well to that back end of almost like the support aspect of training.